Struggling with wrist pain? Carpal tunnel syndrome affects millions. Wrist pain is a common problem that causes pain, tingling, and numbness in the wrist and hand. It is caused by squeezed or pressed nerve due to stiffness, rigidity, or reduced elasticity of the wrist, ligamentous band. This nerve controls functional movement and sensation of thumb, index finger, middle finger, and part of the ring finger. People who do the same hand movements over and over, like typing on a computer, using tools, or playing certain sports, are more likely to get this condition. Individual may feel weak hand when trying to grip or lift things. Sometimes the pain can travel up your arm too, also called as referred pain. The good news is that carpal tunnel syndrome can be treated in many ways. Resting your hands, wearing a special wrist brace, doing simple exercises, or taking pain medicine can help. For complete management and care, the key is to follow long-term management protocol. Signs and symptoms. Numbness or tingling in the thumb, index, middle, and half of the ring finger. Burning or electric pain that travels up the forearm. Weak grip, dropping coffee mugs, struggling with a jar lid. Nighttime flare-ups that ease when you shake the hand. Swollen feeling in the fingers, even if they look normal. In severe cases, visible thinning of the fleshy thumb pad. If you can't button a shirt or hold your phone for 5 minutes without tingling, it's worth seeing a clinician sooner rather than later. Triggers and risk factors. Physical activity. Triggers. Repetitive hand and wrist movements, occupations or hobbies that require continuous motion, like assembly line work, knitting, carpentry, or prolonged use of vibrating tools can inflame the median nerve. Awkward wrist positioning. Keeping the wrist bent for extended periods, whether while typing or sleeping, increases pressure on the median nerve. Vibrating tools. Regular use of power tools that vibrate increases the risk of small joints carpal tunnel syndrome. Associated comorbid conditions. Inflammatory conditions like rheumatoid arthritis and musculoskeletal-related disorders can cause swelling that compresses the median nerve. Hormonal imbalance during pregnancy, menopause, and thyroid dysfunction may trigger fluid retention, increasing pressure inside the carpal tunnel. Metabolic syndrome, like diabetic neuropathy, makes nerves more vulnerable to compression, leading to inflammation. Wrist injuries like sprains, fractures, or other trauma can provoke swelling and reduce the available space in the carpal tunnel. Structural abnormalities. A cyst or tumor within the tunnel can also compress the median nerve. Ignoring CTS may lead to various complications like permanent numbness. Long-term pressure can damage the median nerve. Muscle wasting. The thumb pad can shrink, affecting pinch strength. Decreased hand coordination, affecting writing, cooking, even turning keys. Self-test. For basic understanding, you can have a quick at-home check that may hint at CTS. Sit with your elbows on the table. Let your wrists flop forward so the backs of your hands touch, fingers pointing down. Hold for 1 minute. Note any tingling, numbness, or pain in the median nerve fingers. If symptoms appear in under 30 seconds, schedule an appointment. Healthy wrists usually tolerate the position with only mild stiffness. Diagnostics. A healthcare provider will usually start with your medical history and a physical exam. Tinel's sign. Gentle tapping over the wrist to see if tingling shoots into the fingers. Phelan's maneuver. Holding the backs of the hands together, wrists flexed for 60 seconds. Nerve conduction study. Tiny electrodes measure how quickly signals move along the median nerve. Ultrasound or MRI, used when swelling or other structural issues are suspected. Pain management. Over-the-counter pain relievers such as NSAIDs reduce swelling around the nerve. CE packs, 10 to 15 minutes, several times a day to calm inflammation. Topical creams containing menthol can distract pain receptors. Pain is a signal, not a challenge. Don't ignore it. Exercise therapy is a therapeutic approach that relies on structured physical activity to support chronic muscular stiffness, pain, injury recovery, pain management, and better musculoskeletal function. It customizes exercise programs aimed at rebuilding strength, flexibility to relax wrist stiffness and reduce pain. Gentle stretches and nerve gliding routines help keep tissue pliable. Tendon glides. Start with fingers straight. Bend the top two joints into a hook for 5 seconds. Beginners make a full fist for 5 seconds. Return to straight. Repeat 10 times. Median nerve glide. Arm out to the side, palm up. Extend wrist and fingers, then gently tilt head to the opposite shoulder. Hold 5 seconds, repeat 5 times. Wrist flexor stretch. Extend arm, palm up. With the other hand, gently pull fingers toward the floor. Hold 20 seconds, repeat 3 times. Homeopathy is an alternative approach that offers a holistic and personalized approach to treating carpal tunnel syndrome. Ruta G. Often used for joints, ligaments, especially when there's stiffness with severe pain and sensitivity to touch. Roostox. Indicated for overuse of joints and pain, soreness, and stiffening, worse in initial movement. Actea spicata. Indicated for inflammation with redness and tenderness. Eshhot, weak and lame wrist joint. Urtica urens. Used for burning, itching sensations associated with high uric acid levels. Benzoic acid. Recommended for strong-smelling urine and joint pains. Self-care tips. Warm water soaks. Minutes in a basin, then 1 minute in cool water, repeated twice. The contrast boosts circulation and relaxes the muscles. And turmeric latte. Curcumin has mild anti-inflammatory properties. I mix 1/2 TSP turmeric, 1 quart TSP black pepper, and warm milk, and apply daily bedtime with cover. Epsom salt compress. Dissolve 2 TSP in warm water. Soak a small towel, wrap the wrist for 10 minutes. Elevate. While watching TV, rest forearms on pillows so wrists stay above heart level, reducing fluid buildup. Aloe vera gel. Cools skin and offers light anti-inflammatory effects. It's helpful when there's redness and swelling in wrist joint. Tips for daily life. Switch to an ergonomic keyboard or split keyboard. Keep wrists flat like piano player posture while typing or using a mouse. Take micro breaks, 30 seconds every 30 minutes to shake out your hands. Clench your palm and rotate your wrist clockwise, anti-clockwise, and do flexion extension. Repeat 5 times each. Use voice to text for long emails or typing a long document. Avoid gripping tools or steering wheels too tightly. A relaxed grip cuts pressure in the tunnel.